Hello, my name is Marco Chiaramonte. I will be talking about strategies for managing mental health. Fear, worry, and stress are normal responses to COVID-19 pandemic. We are faced with uncertainty. It is normal and understandable that people are experiencing fear in the context of the COVID-19 pandemic. Faced with new realities of working from home, temporary unemployment, homeschooling of children, and lack of physical contact with other family members, friends, and colleagues. Reduced community and in-person connections leads to increased social isolation, withdrawal, loss of social independence, and affects mental health. We will review the negative impacts of social isolation and reduced social connection, and strategies to managing one's mental health during these challenging times. It is important that we look at our mental as well as our physical health. Wearing masks has created communication barriers to understand speech and clarity of the conversation. It makes it difficult to hear and lip read and follow conversation in a variety of settings, in particular to environments with background noise. Masks can also cause psychological distress and increase issues with hearing problems. This is where your state of emotional suffering associated with stressors and demands that are difficult to cope with in daily life, such as increased trouble understanding conversation in public places, increased hearing difficulties over the phone or on video calls. Public health actions such as social distancing are necessary to reduce the spread of COVID-19, but they can make us feel isolated and lonely and can increase stress, anxiety, and depression. Stress can also cause the following: feelings of fear, anger, sadness, worry, or frustration. It can change in your appetite, your energy levels, your desires, and your interests. You may have difficulty concentrating, which impacts your decision making. You may have difficulty breathing. You may have difficulty sleeping or have nightmares. Physical reactions such as headaches, body pain, stomach problems, skin reactions. You may experience worsening of your chronic health problems or your mental health problems. You may experience increased use of tobacco, alcohol, and other substances. There are also impacts for older adults that contribute to loneliness and isolation. Many older adults do not have the resources required to deal with the stress of COVID-19. This may include access to technology, social connectedness, cognitive abilities. For example, may have some fear leaving their homes. They are considered high-risk population, which increases exposure to COVID, access to grocery shopping, and transportation. So we're going to look at some strategies to help you cope with mental health. You may want to check up with your professionals, for example, your audiologist, your counselor, your family doctor, a social worker. It's been found that people with untreated hearing loss are more likely to experience feelings of social isolation, anxiety, and depression. You do want to check in with your family, your friends, the people that you're close to, and have an open conversation with an open mind. It helps regain social connection and cope with your mental health. You can use technology that can help leverage to reduce anxiety and stress. The ability to reach out to others virtually, ability to do online shopping for groceries to meet your personal needs, to access videos for home workouts, relaxation exercises, and as well as just to connect through news media, using social media to connect with others. You have to take this one step at a time. Don't be too hard on yourself. Give yourself some credit for doing the best you can to cope in a difficult situation. People cope with stress in different ways. You have to choose what works best for you to help you remain calm. People can do breathing exercises, physical activities, going for a walk, or talking to someone that you trust. If you feel you have been experiencing depression, anxiety, episodes of extreme anger, and suicidal ideation, please get immediate help by contacting your doctor as soon as possible. Understanding the signs of mental health illness and having access to mental health resources is critical and can be life-saving for everyone with hearing loss. And remember, protect yourself, good hand hygiene, stop touching your face, and keep your social distancing. Thank you.